It's not often as a surgeon that I connect with patients who are long-term survivors. It's wonderful. It is just wonderful to be able to see a patient who clearly would not have survived more than 6 months and would have been lucky to have survived that long, who has had so many good years of life.
I was married in June of 1997. 6 months later, I was up at Johns Hopkins for a normal, what the CF people, cystic fibrosis people, call a tune-up. I don't remember anything for the next month and a half. And what happened was, I went into respiratory failure. And since my husband of 6 months was my next of kin, not my parents who were there as well, he had to make the decision whether to let me go or have me on a ventilator. The doctors told my parents and Scott that I only had 6 months to live. My mom had gotten a referral to check out Fairfax Hospital lung transplant program because it was a fairly new program, so they probably didn't have a long wait list. And back in the day, it was wait time on list was how you got the organ. Not like today, where people are, sick, whoever's the sickest gets the organs first. So Dr. Nathan came and saw me at the hospital.
At that point, we hadn't taken on any patients with cystic fibrosis as yet, and certainly hadn't ventured into transplanting patients who are on the vent. But I heard that she was very young, and we always want to give young patients the benefit of the doubt as much as possible.
The last person I talked to was Dr. Burton. I remember it like it was yesterday, because I was in a wheelchair at the time because I couldn't walk. I was so feeble, and I couldn't breathe. And he said, "Are you ready for this?" I said, "Absolutely." I said, "Look at me. I can't even walk or breathe. I just bring it on." There's probably about 7 people on the list ahead of me. The set of lungs that came in had B-type blood. Well, nobody on the list had B-type blood, but I did. So I got my transplant the same day that I was listed. And it was a miracle because as you can count back, my 6 months were almost up.
Colleen was transplant number 34 for the program. I believe bilateral lung transplant number 5. So to take on a patient who was that sick and debilitated was a big step for us, but it worked out very well. And she kind of set the path for the future of the program. I was reminding her that, gosh, if she hadn't done as well as she had, then we might have been more reluctant to take on CF patients or take on patients who had recently been on the vent or trached. So not only did we help her, but perhaps unbeknownst to her is that she helped a lot of patients who were transplanted after her.
I did write my donor family and several times, and my mom too, and they never responded, but I would have liked to have thanked them. And I think about them all the time. I think about whose lungs I have in my chest, that I promised them in my letters that I would take good care of them.
The fact that an organ donor can save the life of a number of people and make a tragic circumstance a happy and rejoicing circumstance for another family is obviously hugely altruistic, but a wonderful thing. I mean, we wouldn't have a lung transplant program, we wouldn't have a heart transplant program without organ donation.
Since the transplant, my life has been great. I was able to go back to work for the Navy. I was able to go to Ireland, which had been a dream of mine, and my grandmother's dream was always for me to go to Ireland.
The fact that Colleen is around 20 years later is truly remarkable and an attestation to her, because she's been through a lot, not only the lung transplant but a kidney transplant along the way as well, and she's been a true trooper. She's been a model patient for us in terms of being a real pleasure to take care of in all regards.
I'm just grateful for every day. The sunsets, I noticed flowers, I point them out to Scott when we're walking the dog. We know what's important and what's not important. Inova really did save my life. There's no doubt about it. It was a miracle, and I never would have lived this long. I never would have lived another day or another week if it had not been for them.